Hello everyone, welcome to part 2 of the life cycle strategy plan for Vyvanse or lisdexamfetamine, preclinical pharmacology. My name is Jordi van Enkhuizen. I have a PharmD from the Netherlands and currently I am in San Diego finishing the last part of my PhD studies at the Department of Psychiatry at UCSD. So first, a little information about the product profile of lisdexamfetamine, or LDX. LDX is unique in that it is the first prodrug stimulant. It belongs to the amphetamine class of drugs, and LDX itself is a therapeutically inactive molecule. After oral ingestion, however, LDX is converted to L-lysine, which is a naturally occurring amino acid, and active D-amphetamine, as illustrated here. The process by which this occurs is the rate-limited enzymatic hydrolysis. Now, LDX was developed with several goals, the most important ones being a prolonged and consistent effect throughout the day, less abuse potential, a reduction in overdose toxicity, and less risk for drug tampering. So what are the mechanisms of action of D-amphetamine, which is the active compound to which LDX is converted? Well, first off, the D or dextro in amphetamine indicates that we're talking about the right-turning isomer of the molecule, which exerts its activity in the central nervous system. Basically, LDX is a mixed norepinephrine dopamine transporter inhibitor. Illustrated here, you can see the function of the dopamine transporter, but the same is true for the norepinephrine transporter, where this transporter, located presynaptically, is responsible for reuptake of free dopamine and norepinephrine back into the presynaptic neuron. Less availability of these transporters by amphetamine results in an increase in free dopamine and norepinephrine. Now let's move on to some preclinical studies, and first let's talk about the efficacy. There have been a couple studies where LDX was administered to Sprague Dawley rats, which is a commonly used strain of rats used in preclinical studies. And LDX was primarily administered by intraperitoneal administration, or IP injections. Here we can see that LDX induced hyperactivity in these rats, and that it also increased striatal dopamine, as illustrated here. Now both these effects are consistent with the effects of amphetamine in rodents, both mice and rats. Another study of LDX in the same strain of rats investigated the pharmacokinetic profile of the drug and found that it was readily absorbed from the gastrointestinal tract after oral administration. Several pharmacokinetic parameters are shown in this table. Furthermore, in this study they found that LDX was metabolized to D-amphetamine primarily by red blood cells. Again, they confirmed that enzymatic hydrolysis takes place to convert the molecule, which has some benefits, a couple of them being that the molecule is not subject to variations in factors such as gastric pH or GI transit time. When they compared LDX with a formulation-based delivery of active amphetamine, they found a similar rate of hydrolysis and delivery for LDX. So, to summarize, both the prodrug structure and the PK profile are both features that distinguishes LDX from other CNS stimulants. Now, in order to investigate toxicity, 3 independent rat studies were conducted in both male and female rats given an acute single dose of LDX, a 7-day or 28-day regimen of a repeated dosing of this drug. So the results of this study, they found that the 50% lethal dose, or LD50, for a single dose of LDX was about 1000 mg per kg, which is equivalent to approximately 550 mg per kilogram of D-amphetamine. In comparison, the LD50 for free D-amphetamine is about 30 milligrams per kilogram. So these findings provided promising results that LDX might have a wider therapeutic index than D-amphetamine itself. Furthermore, it was observed that the no observed adverse effect level for a 28-day regimen of LDX was less than 40 milligrams per kilogram per day. Now, to my knowledge, there have been no complete IND package studies conducted for LDX. So, on to a little information about the pharmaceutics or dosage forms used for this product. The molecule itself, LDX, is a very soluble molecule in water, but it is poorly soluble in fatty substances, resulting in poor passive diffusion across biological membranes. Now, in rodents, as I mentioned before, LDX has primarily been given by IP administration or oral administration. In humans, however, LDX has also been studied intravenously, and they found that the PK profile of IV amphetamine from LDX was delayed compared to IV amphetamine itself. But the areas under the curve were similar, however. Furthermore, more oral and intranasal administration have been investigated, and here they found that the only difference was that plasma LDX levels reached a higher and earlier peak after intranasal administration. Maybe not unsurprising. Besides this, however, the PK profiles were virtually identical. Now, with these human results, I want to move into part 3, the early clinical development. First, let's discuss some results from phase 1 studies. In one study, they looked at healthy adults who were given 70 milligrams per day, and they observed that steady-state serum concentrations were reached within 5 days. Furthermore, they found that the half-life of the amphetamine from LDX was about 10 hours, and that of free intact LDX was around 30 minutes. In another phase 1 study, they compared the administration of 70 milligrams LDX in a capsule with or without food, and found that this did not influence the PK profile. Illustrated here on the right are nice dose concentration curves for both the amphetamine from LDX and LDX itself after oral administration in healthy adult volunteers. In these phase 1 studies, they also looked at adverse events and found that these were all typical for amphetamine products, i.e. headache, palpitations, euphoric mood, and or flushing. To summarize, lisdexamfetamine was well tolerated in these studies. So again, these dose concentration curves in this study, different doses were given, and you see nice dose concentration curves. Let's move on to results from several phase 2 studies. In a randomized double-blind placebo and active controlled crossover study published in Biological Psychiatry, both the efficacy and safety of the therapeutic LDX were investigated. Here, LDX was given in 3 different doses and compared to both placebo or mixed amphetamine salts, which is an alternative in the treatment for ADHD. This was studied in children with ADHD, and the most important outcome measures were that 70 milligrams resulted in a good PK profile, and that LDX was statistically significantly more effective compared to placebo as assessed by rating scales. Now, with regards to safety in humans, again, Several studies reported a well-tolerated and safety profile for LDX, with no clinical meaningful changes in vital signs, such as several ECG parameters, as illustrated here to the right, which is a common thing to study, especially in amphetamine products. So finally, when we compare the results regarding the PK profile of LDX in adults and children, it was observed that LDX results in similar profile in both children and adults, which is also similar to the results of mixed amphetamine salts, as summarized in this table. In another study, finally, they studied LDX in elder patients and found that clearance decreased with age, which is kind of expected. However, the safety profile was consistent with younger adults. Thanks for listening, everyone, and now let's move on to part 4.